put me in mind of something. As a preparatory remark, I went and saw my GP this morning, and he did exactly what Tim Spicer said he should do. He checked exactly that on blood pressure irregularity. But interestingly enough, I've been with that practice, a very good Fulham practice, for decades. I'm not so sure, reading some of the planning, the very complex planning about ACPs in here, that had I gone in, as I did with a different condition, he would have picked up what really was behind it. And in practice there, one of the things which actually does surprise me greatly is the way in which an immense amount of work is being pushed onto doctors, onto GPs and GP practices, which are being pushed into federations where it isn't clear that continuity of care, trust with doctors that one knows, will actually survive. And I know what the problem is, because it's actually put graphically here. 55% plus of doctors here are towards retirement age. They may go soon. That means in practice that continuity will be missing, but the money is going into very complex objects, ACPs, etc., which are much harder to understand. The graphics here really are quite hard to understand. I went back over them many times, but it's not clear to me how much control individual doctors, individual practices, the private sector, who will be responsible even when things go wrong, because, as you know, things do go wrong. It's who will pay for things, whether one's actually being put back into the private sector, because in practice, I take Claire Barker's point, you don't want to charge, but once you've brought the private sector in, they're in there quite legitimately to make money for services. And there, the impact on them will be to look at one as a product, unlike my excellent doctor, who looked at me as, well, that gentleman who comes in a couple of times a year over the last 25 years or so. So the place of GPs here is not transparent for patients. And very good for patients, I would say, why aren't you asking widespread notions of patients' groups? But they have not been brought into were mentioned in passing, but not as people to be consulted with. But there's a second related point. As you can see, I'm of a certain age. There's a very great deal of mention here of older people. Now, Charing Cross is to be something for older people. When I say something, I've read and reread all the sections on older people here. There's no detail, none whatever. I'll be damned if I know what would happen in Charing Cross as an older person's facility. It's never defined. Is it a tea and biscuits place, a gym place, a pat on the head place, a full surgery place? I could go on. I don't know. I'm not trying to be sarcastic, but there is not any definition as to what's on offer there. And right throughout the document, older people are mentioned over and over again, but mainly as a cost, as trouble, and not, unlike other groups of people, as patients to be helped. There's lots of mentions, for example, of care homes, but the borough hasn't got them, nor could it afford them under the way budgets are diminishing. Carers are being mentioned, but they come free. 103,000 of them, is it not, in the borough? What's missing here is old people are to be jammed together into something undefined called Charing Cross, which may be a hospital, a sub-hospital, a clinic, a walk-in centre, a tea and biscuits place, whatever it will be. One of the reasons why were I a councillor, I'm not in Stephen's party, I would not have signed this, is that between the aspiration and the end product, there is no strategy. One has no way of knowing when you're going to go somewhere, what the success criteria are, who will be accountable, who will pay for things when they go wrong, and what exactly will be in the institutions which do not exist because they're not explained. And there, I'm not being cynical, I'm simply asking an ordinary, sceptical question as a local resident who depends on the NHS locally. It's been rushed through, it's not been defined, and it's not the kind of thing I think our council should sign up for until there's the kind of detail which makes me know how I or other older people or young people or children will be looked at. Without that, you've got aspiration, which you have on many sides of the page. You've got a point, it's the last point in the appendix, point 10. is that finance underpins everything we do. It's the cutting the budget which seems to me to generate everything else that happens here, whereas the budget should be in support of better treatment. It's the cart really has gone before the horse.
There's a lot in there, I will try to answer some of it. There's obviously a tension between continuity of care and access. And I think that is a tension that will be there whether we have an SDP or not. Because you're quite right in saying that there are quite a lot of GPs, not only in Hammersmith and Fulham, but across North West London, who are close to retirement age. And I'm not sure that it is an either or in terms of continuity and access, because actually the research suggests that different parts of the population value different things at different times because of their health needs. I think that I'm going to be realistic with you. I don't think there are going to be lots more GPs. I think we should be able to, with a lot of effort and energy, hold the number of GPs that we have. What we are trying to do is move to a much more team-based approach of delivering healthcare, so that the GP will be one of quite a broad team of workers who will be meeting needs, and sometimes your care will be delivered face-to-face with the GP, and sometimes it will be with other members of the team. The important thing is that your care is coordinated between that team. Even with that, there are real challenges to always get that balance right. The second thing about federations and the federations of frailty, I'm not aware that federations have been pushed together. My sense, particularly in Hammersmith and Fulham, is that actually the federation has a lot of energy and is a relatively strategic organisation, and it is working well with other parts of health and care, and I do see that as one of the areas that certainly is different from 5 years ago, and certainly will help clarify who at any point in your care is accountable for it. And I would say that would be one of the marks of its success, if you could say, at any point I know who's responsible for looking after me. So there are parts of London where these larger groups aren't very comfortable, but I don't really feel that's true. The other thing, just to go back to the GP situation, is one of its interests is training of staff, including GPs, because it recognises that without workforce we can do nothing, whatever the strategic policy name is at the time. The last thing you're saying about frailty and what's going to happen with older people in Charing Cross, and in a sense it is an iterative process. I've used that word twice today, but at the moment Charing Cross has a facility for elderly people to be seen quite rapidly, to have a full assessment, full planning about their care needs made, and that sometimes can be an alternative to an elderly person going into hospital.
But that's missed my point though. The whole hospital,
yes,
according to the STP, is to become a facility of an undefined kind for people of my age or older. Why isn't the detail there? Because normally when people, as in other parts of the STP, when they know what they're talking about, they actually put the detail, they put the financing and the strategy to get there.
So my sense is the whole hospital won't be that. It will. There are lots of people who aren't your age who need investigations. We saw on the slide that there will be an increase in cancer. We need more rapid access to the imaging that is the thing that has the most effect on cancer treatment.
But so that's what the plan says there.
It's not a single issue facility, it's an issue for multiple ages.
So I just had a couple of points I wanted to raise, because I think you raised some really good points about where is the detail sitting behind this plan. This plan is a very high level plan. It's about a 30-page plan, and it is the most ambitious plan in terms of how you get all the organisations in health and social care working together over quite a geographic area of 2 million people and 8 boroughs. I think the point we need to get on to is about how we do co-produce the different parts of the plan. So we've given you a sort of a high-level outline, and it goes back to Meryl's point a little bit earlier. How do you get involved in the true engagement and consultation around, well, what do the various elements of the plan look like? We've given you a straw man. We highlight 5 different delivery areas. We highlight 22 different work streams that we've got. How do we truly engage the community across our 8 boroughs to help us produce what is an ACP? How will it work across North West London? How do we think about the local hospital model? What will that look like for Charing Cross and for Ealing? So all of those work streams, we do need your help to produce. So I think it would be helpful. I know we're getting towards the end of the time here, but this can't be the end of the engagement. This needs to be the start of the engagement. And the question is, how do we get the right voices on each of the work streams to take that work forward so that next time we meet, you feel you've had some involvement in how do we think about an ACP? What is an ACP? How do I know who will be accountable that's running the ACP going forward? That, I think, would give us some real discussion points and give you much greater ownership of the various projects that are identified within the whole STP. So I think that would be helpful, Claire, to try and just sort of flesh out how we take that forward. Because this is a very brief discussion about a very complex process that we're trying to put in place. And I think this needs to be seen as the beginning of it, not the end of it. So I think it'd be helpful to discuss how you'd like to start taking this forward.